Good morning, sir.
Good morning, Ramprasad. How are you?
I'm good. How are you, sir?
I'm also fine. I will wait for 2-3 minutes. 2-3 minutes, then I will start.
Yes, definitely.
Till time, Dr. Ram, please try to share your screen.
Yeah, just a minute, sir. Can you see, sir?
Yes, sir. Yes, sir. We are seeing. So
Thank
no
you,
problem. No problem. Then you can operate from there. Huh?
Yes. No
If
problem.
any technical problem will arise, Dr. Raut, sir, professor of PSM is there. He will help you.
Definitely. Thank you.
So, Institute of I, Dr. Sandeep Kadu, President of WIMS Alumni Association, and Professor at Dr. Vitthal Rao Patil Foundation Medical College. Welcome all of you. At first, I have very proud feeling about Dr. Ramprasad Rajebhosale. He was from our 2007 batch, and seeing his credentials about his educational qualification, we all, management, our dean sir, and all the staff are proud of Dr. Ramprasad Rajebhosale. He's from 2007 batch. Now almost 15 years has been completed, and there is much more changes in the infrastructure as well as our faculty pattern. So there are many students which are joined from his 2007 batch to get the new environment, our world-class environment of our institute, as well as different departmental information. We have prepared a small video. So before starting Ramprasad session, I request Dr. Pritish Raut sir to start the video regarding our institute. Sir, please.
आवाज नाही.
Yes, Dr. Ramprasad.
Yes, sir.
Yeah, you must have got the insight of about our institute and how the world-class infrastructure is there in our institute. At your time, we were in a developing stage, but now our institute has been well established. I think like UK, yeah, where you are studying, like that environment, our management has established. Before wasting any time, I request our respected Dean sir to guide with a few words. Sir, please.
Good afternoon, everybody. On behalf of Dr. Vithalrao Vikhe Patil Foundation's Medical College and Hospital, I welcome all, especially today's eminent speaker, Dr. Ramprasad Rajebhosale. I congratulate our alumni team, especially Dr. Sandeep Kodu sir and his associates for organizing such a wonderful lecture. And I remember Dr. Ramprasad Rajebhosale. He was a very sincere and obedient student when I was working in the pediatrics. He has also noticed the changes which was there at that time in the campus and academics and which are shown in the video. I sincerely request him, whenever you come to India, you should visit to our college. I am personally and on behalf of Institute really proud of you that our all the students are settling in the good field and they are serving for the nation and for country as well as for the world. So I remember the days of Ram Prasad when I look him in the apron and today what I am looking in the blazer and tie. It is really the metamorphosis along with the knowledge and all these things. And very good to see him in this new change form. So our all the students are also participating and viewers of this today's session. So of course, your views and opinion and your experience will be very, very useful for this our running present alumni students. And I welcome you again in this lecture series and again request you, whenever you come to India, please meet us and see the changes and be in touch with us. So I wish all the best for your future. Thank you.
Thank you, sir.
Thank
Thank
you,
you
sir.
very much.
Thank you, sir. One announcement to all the students is there. Already there is overwhelming response that more than 100 participants, because our limit is of 100 participants, but we have also made a YouTube link and I have sent all the YouTube link to all the GS of all the batches. Those who want to listen this session, they can join on a YouTube link. Second thing, now I request my friend Professor Dr. Pritish Raut to introduce our eminent distinguished alumni, Dr. Ramprasad Rajebhosale. Sir, please.
Thank you, sir. Hello and welcome all. Here I would like to give a brief introduction of Dr. Ramprasad Rajebhosale. After graduating from our own institution in 2012, Dr. Ramprasad has completed DNB in General Surgery from Government Medical College, Kolhapur. Then he had fellowship in Minimal Access Surgery. After becoming a member of Royal College of Surgeons, England, he has an MCH in gastrointestinal surgery from Edge Hill University, Ormskirk, England. Dr. Ramprasad is very enthusiastic learner and has completed many short courses such as Care of Critically Ill Patients from Royal College of Surgeons, England, Laparoscopic Inguinal Hernia Hands-on Workshop course from University Hospitals of Derby and Burton, Basic Skills in Colonoscopy from St. Mark's Hospital, London, and Introduction to Robotic Surgery from ICENI Center. Having worked as laparoscopic fellow in general and colorectal surgery at University Hospital of Derby and Burton, Dr. Ramprasad is presently working as robotic fellow in colorectal surgery, Colchester General Hospital, UK. Apart from academics, Dr. Ramprasad is also interested in swimming and water polo, in which he has won 32 medals in divisional and state level competitions. So without any further delay, as all our students are very eager to listen to Dr. Ramprasad, I request him to please guide our students. Sir, please.
Thank you very much. Thank you for very brief and nice introduction. I would like to first thanks Kadu sir and Maske sir, who have really given me this nice opportunity to present in front of all wonderful medical students. And I've seen how the hospital and college has changed from my batch to this now current batch. Well, without wasting much of a time, I would like to start my presentation. Let me just share my screen. And can you see my screen, everyone?
Yes, sir. Yes, please.
Okay. Well, so I don't need to introduce myself, as sir has kindly done that. And today's topic will be surgical training opportunities in UK for all Indian graduates. So I'm talking about general surgery and as well as specialty in surgeries, but obviously it does apply to all other specialties, including medical field, radiology, ophthalmology. So in general, it applies to everything. But because I've gone through this process, I know about this process, I will tell in detail about how you can progress in surgical field in United Kingdom. Well, this is my batch, 2007-8 batch. We were also called as Spartans. And this is the batch we graduated in 2012. About the hospital, sir has already told now how much it has changed. When we were there, it was our fourth batch and we had only 2 boys hostel and 2 girls hostels. And I could see there was a 7th hostel as well now, with swimming pool and lots of good, fantastic facilities. So thank you for giving us such a good opportunity to pass out from such a wonderful institute. Well, I think so you all have noticed I had written in my name Mr. Ramprasad Rajebhosale, but not doctor in the beginning. Now, if someone might have noticed that and he would have been wondering, why is that? Well, just quickly, I would like to tell surgeons in United Kingdom, they prefer to be called as Mr. for male surgeons, and for female surgeons, they refer it as Miss, not doctor. Why? Well, there's a story behind it. Because initially surgeons were merely known as butchers and not the graduates who were passed from Royal College of Physicians. Hence, they were not awarded degree. But then eventually time has changed and now surgeons also go through that tough curriculum. So Royal College of Physicians agreed to give the degree, but then, surgeons, they always have a lot of egos. So they said, no, we would like to be preferred as Mr. or Miss. We don't want your doctor degree. So that's why if anyone surgeon or any female surgeon, they will have this prefix Mr. or Miss in front of their name. So what do general surgeons do in the United Kingdom? So most of the training here is that they subspecialize in one specific area. Like in India, we do subspecialize in general surgery first and then enter into subspecialty, or also we call it as a super specialty. Here, from the beginning itself, there is a subspecialty. So it's like a straight run-through program before from core training and then ST training. But they always cover emergency on calls. So they must maintain these general skills to participate in general emergency services. Now, what are the steps to start working in the UK? Very important step that you should determine what is your long-term goal. So what you want to do in future. It's not just like in next 2 to 3 years, but then it's a long-term goal. Then you need a registration with GMC. So how to get a registration with GMC? That is very important. First, there are multiple routes. For MBBS graduates, what you can give is something called as a PLAB exam. So clearing PLAB exam, you get registered with GMC. So GMC is a body like, for example, Maharashtra Medical Council. So if you want to practice in Maharashtra, you should get registration with Maharashtra Medical Council or Indian Medical Council. Similarly, if you all want to practice in United Kingdom, you should get registration with GMC. So GMC is a medical body in UK. So you need to either get a PLAB, or those who are surgeons, those who have already completed surgery, they should complete MRCS, or those who have completed medicine, they should give MRCP. So these are equivalent degrees for specific field, and then you get registered with Government Medical Council. Once you get registration, then you need to find a suitable job which is good for you. Well, I will go through in details how you can find a suitable job. Once you've got a job, now you should get a work visa. And then obviously, then you start your work once you get the visa. Now, as I mentioned, this is very important and crucial step is to determine what is your long-term goal. So there might be three options, what you want to do in United Kingdom. First, well, you want to become a recognized UK consultant. So if you want to stay in UK for a long term, you want to settle here, or if you want to migrate elsewhere after, it's up to you. Or like, for example, Australia or any other New Zealand, any other Arabian country, so which accept this UK consultant degree, you can go there as well. So you can become a recognized UK consultant, and then you can decide you want to stay here or you want to go to somewhere else. The second option can be you can work long term as a general surgeon in UK without becoming a consultant. So that is called as a registrar post. So you can be a registrar, but you don't want to be a consultant, because there are lots of responsibilities which come being as a consultant. And the third is you can complete a fellowship, gain some experience, whichever experience you want, laparoscopic experience or NHS experience, because different healthcare system, you will get to learn lots of different things, doctor-patient communication. So these are lots of things which you can learn, small things. Get this UK experience, and then you can return back to your country. As I mentioned to you, this long-term goal is very important. If you don't decide that before application, then you will be wasting a lot of time and money for the pathway which you don't want to go. So determine what your end goal is. Where goal one, how you can become a recognized UK consultant for a surgeon, as well as it does apply to other specialties as well. So if you want to be a consultant, you need to be on GMC's specialist register. So this is a body where you have to be on. How you can get onto a specialist register? There are three pathways. So CCT is the first pathway. And then second, we have a CESRCP. And third one is CESR. I will go through all these pathway in further slides. So these are three routes where you can enter into general surgery training residency program. So I'll go through each one in detail. So what is CCT route? What do you do in CCT route? So there is a 2-year core surgical training program, which is like basic surgery. So you go through various rotations. For example, you go through general surgery, urology, vascular surgery. So these are 6 months to 1 year, 2 years of program. Once you finish that 2 years of core training, then you have to apply for ST3 training. And then this is again starts from ST3 to ST8. So this is a 6 years higher surgical training program. When you complete these 8 years, then you will be awarded called as a CCT, that is Certificate of Completion of Training. So you get qualified as a consultant straight once you enter into a core training, and then you pass out. Like for example, in India, you enter into MS or DNB, and then you pass out after 3 to 4 years, or you enter into MCH, and then you pass out, and then you become consultant directly. It's the same way. So this is the best for new graduates. For example, those who have passed MBBS recently and completed their internship. So this route is the best for them because they can go through straight and come out as a consultant. So, and also very important, this is for those who haven't completed any postgraduate training in surgery or any other field, because they'll be considered as overqualified. So this is the CCT route, which I mentioned to you all. So first you finish your MBBS, then you enter into foundation training, that is our internship, that is 1 year internship. This is applicable for India. So internship in United Kingdom is for 2 years. So as you have finished 1 year of internship here in India, then you can enter into these programs. Well, 1 year UK standalone post. So you have to do another year of standalone FY2, that is foundation year 2 or internship year 2. In UK, they do 2 years of foundation program already. So once you finish this, and then you can enter into core training, which is for 2 years. At the end of it, you have to clear MRCS, that is Member of Royal College of Surgery, and then you enter into subspecialty or higher surgical training, that is 6 years of UK surgery, and then you pass out having a FRCS degree, that is completion of training in general surgery, and then you become UK consultant. Well, as I mentioned to you, there's a twist in this. So if you have experience of more than 18 months after internship, then you will be considered as overqualified for CT1 training, and then you cannot pursue this route, CCT route. And now what happens, like most of the DNB graduates or MS surgery graduates, they'll think, okay, well, I can't enter, then what options do I have? So this is the next option you have. You can enter into CESR CP or CESR route. So what is CESR CP route? So CESR CP stands for Certificate of Eligibility for Specialist Registration Combined Program. So this is for us, those who have completed DNB, those who have completed MS, or those who have completed MD, and those are considered overqualified for core surgery. So now here you can directly enter into ST3 training. So that's a specialty training year 3, and then you finished 6 years of training program, and then in the similar way you become the consultant. So as I mentioned, you finish international graduation, internship, you have finished your core training, and then you have given this MRCS exam, and then you can enter into 6 years of training and become UK consultant. CESR route. Now this is for senior people or those who have completed their training and don't want to go through this training anymore. So some might say, okay, well, I'm fed up with training. I don't want to be in training anymore. Well, some people might think this is a shortcut, but well, it's not. So I'll just explain what CESR route is. So those who have completed the training and those who have been practicing as a consultant for a few years, and those who have completed residency and do not wish to repeat their training. But then you need to provide lots of documentation so that you have an equivalent experience and training, which we should start collecting from MBBS as well. And you get it signed off from your teachers, your deans. So everything you should get signed off as early as possible. I will tell you what documentation they require. So as I mentioned, this is CESR, then 12 months of internship, you have done your specialty training, you directly apply for something called as Article 14, that is CESR General Surgery, and then you could become consultant. Well, goal 2. Now you want to be working here as a general surgeon, but you don't want to become a consultant. Well, because sometimes few people find these responsibilities are quite a lot and they're unattractive. There might be lots of medical issues. So you don't want to be a consultant. Well, that's also fine. So you can work here as a registrar post as long as you want. But then you should be aware that you get less operating time compared to consultant and trainings, because consultants have the responsibility and the patients obviously come under their name. So you get less hands-on, less cutting. And obviously it varies hospital to hospital. Some hospitals are very good in training, some hospitals are not. So it varies based on hospital to hospital. And goal 3, I think so most of the us or, so I don't want to generalize, but this is another route what you can do. So you complete fellowships in the United Kingdom, get this NHS experience, and then you want to go home and serve our patients back home. So this is goal 3. So you can apply for Royal College fellowships. So if you go to Royal College of Physician or Royal College of Surgeons, Royal College of Gynecology, Royal College of Ophthalmology, you can go to their website and then you find out for fellowships. So you can make a good use of internet and then you can find all these jobs which are available. In United Kingdom, this is the website which is very important, which you can log into it and look for jobs in various specialties. So you can filter them which jobs you want. So this is the website you should go in on, log in, make your account and keep applying, because everyone who comes to UK eventually applies through this website. So just take a screenshot or note this so that you can quickly apply through this for these jobs. So what are the exams you need to give? So first, as I mentioned, MRCS, that is a member of Royal College of Surgery, which comes in 2 parts. First is a written part, and then the second is a practical part. And this, you should pass this to apply for ST3 general training. And the exit exam, that is known as Fellow of Royal College of Surgery, that is FRCS. Again, it has 2 parts, written and practical or oral exam. And it has to be completed after, at the end of your 8-year training. Most of the residents finish it during 6th year or 7th year of their training. How can you apply for core training? Well, to apply for core training, there you should have a GM's registration, as I mentioned earlier. So how you can get that? PLAB exam or MRCS or MRCOG, as I mentioned earlier. What you need, you need 12 months of clinical experience by the time you start your ST1. So that means 12 months of internship and another 12 months. So 2 years of foundation year training. And then if you have completed DNB or MS surgery, then you need to be signed off for something like a certificate of readiness to enter specialty training. So there is a form, it's a small form, which you have to get this signed from a consultant in United Kingdom. So one of the consultant has to sign you off. Okay, he can enter into that ST3 training directly, and he has equal competencies like core training. And then you can apply for ST3. So this form is again must. So when you Google it, certificate of readiness to enter specialty training, there's a form. So you will get that. And these are the basic requirements. You need PLAB, you need either MRCS or any MRCOG, all this. So for GMC registration and this certificate of readiness form. If you want to know what are the further requirements, you can obviously, you can see these websites, you can Google it, and then you will get all the specifications which are required. So for ST3 training, again, as I mentioned, those who complete their DNB or MS post-graduation in India, please make sure you have a validated logbook of all the surgical procedures. So for example, you have done a central line, all small stuff, tubectomy, whatever it is. So you should have a logbook, and it should be signed off by your head of department and your dean sir. So you need a validated logbook. This is very important and crucial for all MBBS students. You should have a good portfolio. Now, what is portfolio? When I was an MBBS student, portfolio was not for doctors. This is what I used to think, but well, it's not true. You need a good portfolio. I'll go through what you need to be to have a good portfolio. And then as I mentioned, you need this form to be signed off. You need MRCS or equivalent degree, and then you can enter into ST3 training. Well, again, go through the specifications, exactly what they want, because they score you based on how many publications you have done, how many audits you have done, and then everything is taken into consideration. So you can get all this further informations about core training application, ST3 training applications, and which is the website where you apply for this. That's oriel.nhs.uk. Again, you can take screenshot of this and then you can Google it. You can apply on these websites. Is it difficult to get into UK general surgery training? Well, I must say it's not very easy. Is it easy in India? No, it's true. So this is same all over the world. It's not different in UK. It is difficult, but then if you want to achieve something, you have to work hard. For core surgery, now this is the data, past data. There are approximately around 630 vacancies each year. And how many people do apply? 1,800. Now you must be wondering, why? Because as surgical training is so lengthy, or any medical training is lengthy, and to become a surgeon, it has got a long learning curve. So people in United Kingdom or the medical graduates in United Kingdom are not very keen into going into surgery. There are a few, so that's why we have less applicants. The most applicants are from either rest of Europe or from Asia. So there are lots of applicants from India, there are lots of applicants from Pakistan, there are lots of people who do apply for these core surgery jobs. Again, as a ST3 level, how many jobs you have? 200 jobs. So you can see there are around 630 who clear core training, and then there are 200 jobs available for ST3. Again, the competition increases. It's same like MS DNB and then MCH DNB in India. So the competition increases. Well, as I mentioned, general surgery is one of the less competitive training program but it is still competitive. So you require hard work and then you will succeed. Now I must say, this is a golden opportunity for IMG. So that is International Medical Graduates. Why it is a golden opportunity? Because in 2019 October, immigration laws have changed. That means, what does it mean? That those who have passed from United Kingdom, they are no longer prioritized for training post. So even if you have passed from India, you have an equal opportunity to enter into training. So they are not prioritized. But what is most important is the application score. So this score is very important. Now, as I mentioned to you, how to build your CV. Well, this is very important. And this is when you can succeed in your interviews and you can get into nice and good jobs. What do you need? First, evidence of teaching trainee doctors, medical students, or nursing colleagues. So if suppose you take a lecture for medical students or you take a lecture for nursing students, what you need to do? Get a feedback form. Well, how was the presentation? Did you like it? What are the changes which I should make? And this is learning for you as well. So you can learn from them. Okay, I am not very good, so I need to improve myself. I have to improve my slides. How should I present? So this is a learning for you as well. And then this evidence, you should get it signed off. So keep this in a folder so that you have taught medical students. Again, any evidence if you're organizing any teaching events or any conference. So we do most of the time. So our annual gathering. So there is some organizer, someone is a sports secretary. So you get a certificate that I was a sports secretary for this annual gathering, or I was an art secretary. So this is very important. So this, you should get all these certificates. You make your own certificate, that's fine. Or you can request, our Kadu sir or Maske sir, they can give you the certificate. They are really good people. I do remember when in my final year, I had given our pediatric quiz competition. I was selected. I went to Pune for this quiz competition, and I had that certificate. So this certificate helped me to get into a job. So it does also show that you were good in other activities, you were good in quiz. So these certificates you must get. Presentation and publication, this is very important. As a medical student in India, we don't focus much on publications and research. You must do it. There is no shortcut to this. Small case presentations. So you can go to any of the head of departments, ask them any interesting case they have come across. Go through the publications criteria, BMG criteria, how they publish these case reports, and publish these case reports in any conferences. You get certification. So you should publish this case report. You should publish your good research, and this adds a lot of value. And you should publish them in well PubMed indexed journals. Please underline PubMed indexed journal, because any journal, it's not accepted. Journals who are PubMed indexed, so they are accepted for your CV. Then any courses or conference you have attended, keep those certificates, don't throw them. So you have attended any conference, please keep that certificate. So any letters or cards from patients or letter of appreciation from your colleagues. So what we do, we get the appreciation from our friends. So most of our patients, they write something on paper and they thank you. So this is not, we feel nice, we keep it for a few days and then we throw it away. Don't do that. Keep that with that folder, because this is something which is appreciable. That you are a good doctor. It shows that you are a nice person. So any management responsibility, as I mentioned earlier, as a lead responsibility, you should do that. Logbook, very important. Any small procedure for MBBS students, even if you do a Foley's catheterization, you insert a cannula like Gelco. This is also very important. So this shows that you have done that. If you don't have a proof, then how they will believe? So you should have this logbook of all the procedures you have done. And then you should have 3 referees. So you should have good contacts. So you should have good contacts with your teachers. So the referees are basically your teachers and your head of department, your dean. So you have to be good in their eyes. So you have to be sincere, obedient. And then they will send the references. Well, is this student was trained under you? Yes or no? And was he a good student? So you need good 3 referees. Doesn't mean that you shouldn't be good with others. You should be good with all teachers and they are respectable. Now, important, please consider. Now you must be saying you're going to UK is not a walk in the park. Well, it is not, because it comes with lots of money, but you can manage that. You start saving some money. When you get into internship, you get some stipend. When you get into DNB or MS, you start getting some stipend. Start saving some money per month, and then you eventually have that enough amount so which you can eventually use that. How much salary do we get in United Kingdom? Well, for MBBS students, those who have passed FY2 foundation training, they get around 2.5 lakhs in rupees. So that's around 2,500 pounds. So that much amount you get as a salary. Isn't that good to come in UK? Well, so fees, if you enter into core training or ST3 training, you get stipend or salary. You don't have to pay any fees. But if you come through various fellowship programs, so there are certain fellowship programs, they actually sponsor you and you get paid. And there are few where you have to pay fees. So those fees vary. So if you go on their websites, they will be clearly mentioned how many fees you have to pay. Sometimes some courses you have to pay fees, but they deduct it from your salary. For example, you're getting a salary of around 3 lakh rupees. So they will deduct around 1.5 lakh rupees and they'll give you 1.5 lakh rupees. So you can manage everything. So this is fees. Training from surgery, the training I must say is really good, because in NHS, this is all government bodies and your seniors, teachers, they make sure you get trained well. Although it's a slow learning curve, but the learning curve is really good. You get trained well. And then obviously when you're moving to some other country, you have to think about family as well. So these are the things you must consider. Now, this is something which has always influenced me. This is by Robert Frost. The two roads which were diverged in a road wood, and I took the one which was less traveled by, and that has made all the difference. Well, this might inspire someone. So best luck, everyone. You have any questions, any queries, obviously you can get back to me. So you can email me. Basically, best of luck. Thank you.
Hello. Dr. Ramprasad, very nicely explained. I think our student must get inspiration from you as well as motivation from you. As you have explained one word, I want to say that you have mentioned IMG, that is International Medical Graduate. But
Yes.
now in India also, since 2019, competency-based medical education has come. The students now which are hearing are from the competency-based medical education, and we are also using that word IMG, means Indian Medical Graduate. Uh, so that the coincidence, and what you mentioned that all should have the logbook. Now this competency-based medical education is a compulsory to all the students. They should have their logbook with them, and all what you have mentioned, small procedures. There are certified skills are also there. So all these are in their logbooks. So it might help them in their future endeavors. So from Avdut and all batches, I request if you have any query, you can ask to Dr. Ramprasad.
Thank you, sir.
Yes, anybody? Now, if there are no query, but Ramprasad, I'm really impressed on your speech, how you are very politely, silently told, point to point, different ways, how you can get admission at UK as well as you can practice as a consultant or resident like this. I'm very proud of you, boy. I request the GS Avdut Mani to give the vote of thanks. Avdut, please.
Thank you, sir. First of all, I would like to thank respected Secretary General Dr. Sadananda sir and respected Deputy Director Dr. Abhijit Dute sir for supporting us to conduct this session. I would like to thank respected Dean Dr. Sunil Lata Maske sir for his valuable guidance. I would like to thank respected Dr. Sandeep Kadu sir, President VIMS Alumni Association, for organizing this session. I would like to thank Dr. Ramprasad Prakash Rajebhosale sir for enlightening us about the job opportunities for medical students in UK. Sir, this was a very informative and helpful session. I am sure many students, those who are willing to practice abroad, will look up to you. Lastly, I would like to thank all the audience for attending this session. Thank you.
Thank you, everyone.
Dr. Ramprasad is the small certificate from our institute. I will mail you as well as I will also post on your WhatsApp. Again, I'm very thankful for your valuable time. Have a nice day. God bless you.
Have a good day. Take care, everyone.
Raut sir, thank you very much.